I know it might seem like a far-fetched thing to say, but the truth is, many contract rehab companies are essentially stealing from you and from their patients. It's not because they don't care. It's not because the therapists are bad people. It's not because somebody is doing something that's technically wrong. There's just a lot of gray area in how things can be interpreted in this PDPM world. And unfortunately, what we have seen is uh, large contract therapy providers that are delivering only 15 minutes a day for all skilled patients. So it's cookie cutter treatment. And obviously, it's not sufficient volume, not associated with good outcomes. But they're providing 4 units a day for all Part B patients. So they're doing 4 times the therapy volume for Part B patient that they are for a skilled patient. Obviously, this makes no clinical sense. We all know that the volume of therapy services has declined with the advent of PDPM. And I think some of that was more of a right sizing than anything else. I think there probably was some overutilization of volume under rugs, and now we've kind of normalized. But unfortunately, we've seen the pendulum swing for some providers, and they're out there providing little to no therapy for your skilled patients. Therapists are extremely frustrated with this. It's very demoralizing. They know it's not right, but there's not much they can do about it if the company is requiring them to do something like that. And obviously, it puts your community at a huge risk to see audits and denials, because if I was a managed care payer or Medicare B and I saw you're giving 4 units for all your Part Bs and 1 unit for all your Part As, I'm going to try to deny the 3 extra units that you're giving to all your Part Bs, because if a skilled patient doesn't even need that, how can you argue that a long-term care one does? And I'm certainly not saying that all of our volume has to be the same between short-term and long-term. There's a lot of variability there, but it should be resident-centered, patient-specific, based on the case mix group that patient is falling into, rather than these extremely low volumes. So if you're not sure if that's happening in your community, perhaps your gut instinct is going off as I'm talking about, wow, I wonder if that's happening. It doesn't seem like patients are getting the therapy they need. That patients are complaining about not getting enough therapy, and they're not really seeming to get back home in the amount of time that they should. All of those are good reasons to go and ask your therapist, or go and ask your director of rehab or your regional manager. I want a report that proves to me how many minutes per day are being provided on average for the patients on caseload. And that is extremely helpful for you in making a decision about whether or not you've got the right provider in your community. And I would add to that you really want to think about whether contract therapy even makes sense anymore. I mean, the truth is, under rugs, it made lots of sense. Under the traditional rugs-based CMI, where if you got a rehab rug for a long-term care patient, it trumped basically anything else you could do from nursing, it made a ton of sense. But in this PDPM era, and especially now with PDPM Medicaid, therapy continues to provide a tremendous value. But, contract therapy has inverse interest to the facility's interest. Contract therapy wants to keep their costs down, and you want to provide the appropriate amount of therapy so your patients do well. You have good quality measures, you have great functional outcomes, managed care payers like you, we get patients home in time. So, the incentive of the contract therapy company with this new model that's been adopted under PDPM really does not serve the patient well. And most of the time, unfortunately, it doesn't serve the community well either. So it's really time to rethink, is contract therapy the right idea? Maybe it makes more sense for you to go in-house with outside support from someone like Gravity. That's one of the things we specialize in, and we do it in a really unique way. So if you have any questions about that, feel free to reach out to me, but definitely food for thought to take with you today.